What is polycystic ovary syndrome and can nutrition help? Let's talk about that. How's it going, guys? My name's Richie Kirwarn, and today we're going to talk about one of the most common conditions affecting women that you've never heard about: polycystic ovary syndrome, or PCOS. So, if you've never heard of PCOS before, that's not surprising. But what is surprising is that it affects almost 1/5 of women of reproductive age, making it the most common hormonal condition in this group. What's also surprising is that PCOS is one of the leading causes of anovulatory infertility in women, and still very few people know about it. Hopefully, we can change that a little with this video. Now, before we go any further, I just want to point out that in this video, we're not offering any diagnosis or claiming any treatments for PCOS. If you suspect you might have PCOS, go to your doctor and get a proper diagnosis and treatment. What we are going to do in this video is talk about what it is, how PCOS can affect health, and offer some lifestyle-based nutrition and exercise recommendations that can help support women with PCOS to live a healthier life. I also want to say a big thank you to both Georgia Kohlhoff and Dr. Amelia Thompson, who gave me a huge amount of input on some of the nutrition and exercise strategies for PCOS that I'm going to talk about here. So, PCOS is a condition that results in alterations in hormone production in women. But because it's a syndrome, or a group of different symptoms that can often associate together, it often can look very different in different women. The most common groups of symptoms which are associated with PCOS are hyperandrogenism, which means an excess production of testosterone, which can lead to hirsutism, or excessive hair growth, and even male pattern baldness in some women. Insulin resistance, which is a reduced ability of the body to respond to the insulin that we produce. This is often associated with poor glycemic control, or blood sugar control, and it leads to a greater risk of obesity, diabetes, and even cardiovascular disease. Chronic irregular ovulation, which can manifest as irregular or painful periods and can be linked with infertility. And finally, polycystic ovaries, which means having a lot of cysts in the ovaries. To be diagnosed with PCOS, you may only need any two of the symptoms which I've just mentioned, which means you can have polycystic ovary syndrome without actually having polycystic ovaries, and you can have polycystic ovaries without having PCOS. If all of that doesn't sound particularly pleasant, it isn't. So managing symptoms effectively through diet and exercise can be really important for women with PCOS. So let's start with one of the most common manifestations of PCOS, and that's excess body weight. It turns out that women with PCOS are much more likely to be overweight or obese compared to women without it. Now, that said, there is a type of PCOS called lean PCOS, where women can have the other symptoms of PCOS, but while maintaining a normal body weight. For women with PCOS and obesity, losing some excess body weight can be beneficial, and some studies show improvements in hirsutism, insulin resistance, and circulating androgen hormones like testosterone. In fact, a number of studies have shown that reduced calorie diets and weight loss of about 5% of body weight can lead to improvements in the regularity of periods and even fertility in some women with PCOS. Now, there's a couple of reasons for that are worth mentioning here. The first is the fact that women with PCOS can have a much lower metabolic rate than women without it. In fact, one study found that women with PCOS and insulin resistance can have a 40% lower basal metabolic rate than women without PCOS and insulin resistance. In the same study, women with PCOS but no insulin resistance had higher BMRs than that, but lower BMRs than the general population. That is a huge difference in metabolic rate, which means it can be a lot easier for women with PCOS to gain weight eating the normal recommended daily amount of calories for women without the condition. That means women with PCOS may need to be a little more conservative with calories compared to the general population. To make matters even more difficult, there is evidence that the increased levels of testosterone in women with PCOS can affect satiety hormones like CKK, meaning those women have an increased appetite and food cravings and are more likely to have a tendency to binge eat as well. So, what can you do practically to help with weight reduction in PCOS? All the principles of calorie deficits still apply in people with PCOS, so I'd really recommend checking out my video on how to plan a calorie deficit. The only difference, like I've already mentioned, is that someone with PCOS may need to be more conservative with calories. This is where food choice can be hugely important. If you've watched a few of my videos, you'll know that one of the most important factors for long-term weight loss is being able to stick to a diet long-term. One way to help you stick to a diet is to eat foods that help keep you feeling full and that keep hunger at bay. Firstly, get plenty of protein at each meal. Protein is the most filling macronutrient and helps keep hunger at bay for longer. Aiming for at least 30 grams of protein per meal is a good rule of thumb. Next, eat plenty of low calorie density, high volume foods like fresh fruit and vegetables. These keep you feeling full and have very few calories to help keep your overall calories low. That can be as easy as aiming for at least 2 servings of fruit or veg with each meal. Stick to high fiber foods or high fiber versions of foods. Fiber can keep you feeling fuller for longer by absorbing water in your digestive system and slowing the emptying of food. That means foods like fruits, vegetables, whole grains like whole wheat products and oats, and legumes like beans, peas and lentils can help keep you feeling fuller for longer. This type of eating plan, based mostly around whole foods, will also have a low glycemic load, meaning it will have smaller effects on your blood sugar, which may have some benefits in PCOS for helping to improve insulin sensitivity. You may also hear a lot of sources online say that you need to eliminate carbohydrates and go keto if you have PCOS. That's simply not true. While a keto diet is absolutely fine if you like eating that way, and it can help you with weight loss in PCOS, there is no reason that you need to do it. You'll hear a lot of people mention a lot of pretty extreme diets that they claim you'll need to follow if you have PCOS. They might say you need to go gluten-free or avoid dairy, cut out sugar, or go completely carnivore on one extreme or vegan on the other. It's all bull. Because food cravings can be higher with PCOS, allowing yourself some of the foods that you crave, like carbs, for example, in moderation can be a good strategy to help you maintain an overall healthy diet. That said, because calories can be lower for people with PCOS, that means that overall carbs may be lower too, as you'll want to make sure you're getting enough protein and sufficient fat in your diet. In that case, it might be a good idea to bunch your carbs together to make a more enjoyable meal, while other meals might be lower in carbs. Bunching those carbs around your workouts, either before or after, might be helpful too for fueling your workouts properly or improving recovery, depending on when you have your carbs. In particular, bunching your carbs earlier in the day can be beneficial because we naturally are more insulin sensitive in the mornings. Which brings me to my next point. Besides diet, exercise can also be really important for women with PCOS. A combination of aerobic and resistance exercise can not only reduce insulin resistance, but it can also raise resting energy expenditure, which I've already said can be low in women with PCOS. On top of that, resistance exercise and exercise in general can help to reduce the risk of many of the health conditions associated with PCOS, like cardiovascular disease and diabetes. What's really impressive is that exercise can have many of these health promoting benefits even without any weight loss, which is yet another reason to make exercise a regular habit. Getting at least 30 minutes of moderate to high intensity exercise daily is recommended for health. And if you can add some resistance exercise like weight training 2 or 3 days a week, that can help maintain healthy muscle and strength levels too. I talk all about the benefits of muscle as we age in my past videos too, so check them out for more recommendations. Now, while I've been talking a lot about weight loss for PCOS, it's also worth mentioning that women who have lean PCOS, meaning they don't have a lot of excess body fat, shouldn't aim for weight loss. Instead, they can use a lot of the diet and exercise strategies I've just mentioned while maintaining their healthy weight. Losing weight may not be helpful in lean PCOS. Besides diet and exercise, there are some supplements that might be really useful in PCOS. Without a doubt, the most exciting evidence for supplements in PCOS is for inositol, or specifically myo-inositol. This is because there have been a lot of studies showing that inositol can help with the insulin resistance that is common in PCOS. Inositols are substances that are naturally produced in our cells, but because of the hormonal disruptions in PCOS, they can be metabolized slightly differently. In PCOS, supplementing with inositol can increase insulin sensitivity, reduce androgen hormones in the blood, improve blood sugar control, and even help bring back normal ovulation and periods, and even fertility. Inositol seems to be a very safe supplement to take, so current recommendations are 2 grams of myo-inositol twice a day, so 4 grams in total. Another supplement that might be worth considering is berberine. Berberine is a compound found in the roots of some plants that are commonly used in herbal medicine. For women with PCOS, supplementing with berberine seems to have many of the same benefits of myo-inositol. That means it can improve insulin sensitivity, reduce level of androgens in the blood, improve blood lipids like cholesterol and triglycerides, and even help to reduce chronic inflammation, which can be seen in PCOS. In fact, some evidence suggests berberine may be as effective as metformin, a drug used to improve insulin sensitivity in people with diabetes and women with PCOS. A berberine dose of 500 milligrams 3 times a day for a total of 1500 milligrams may be useful. Another interesting fact is that women with PCOS tend to have lower levels of L-carnitine, a molecule involved in fat metabolism, and levels tend to be even lower in women with PCOS and higher levels of body fat and more insulin resistance. Because of that, supplementing with L-carnitine may actually be useful for women with PCOS by helping to improve insulin sensitivity, reduce body fat, improve hormone levels, and even restore a more regular menstrual cycle. We still need a lot more evidence before we can say it's definitely effective, but it may be worth trying a dose of 1000 to 1500 milligrams twice daily. And just on a final note, you'll know that I recommend long-chain omega-3 supplements like fish oil or algal oil for general health, especially cardiometabolic health. Because women with PCOS have a greater risk of diabetes and heart disease, it may be worthwhile taking a long-chain omega-3 supplement too. Fish oils have been shown to improve risk factors like insulin resistance, cholesterol, and triglycerides in women with PCOS. A good daily dose to aim for is about 1000 milligrams of combined EPA and DHA, the most bioactive omega-3 fatty acids found in fish oils, or if you're vegan, in algal oil supplements. We really have covered a lot in this video. If you have PCOS yourself, you'll know how hard it can be dealing with the symptoms. Like I've already said, speaking with your doctor should be your first port of call in helping you to manage it. On top of that, I really hope that the lifestyle and supplement recommendations I've just gone through here might be able to help alongside the medical treatment you receive. As always, if you have any more questions, let me know in the comments below, and remember to like and subscribe to the Myprotein YouTube channel for more great evidence-based nutrition information.